This segment of DelmarvaLife is brought to you by TidalHealth.
It is a story that goes all the way back to 1897 when Peninsula General Hospital first opened its doors. Remember everybody calling it PGH for the longest time? Of course, this hospital would eventually become TidalHealth Peninsula Regional, the one that we know today, and a year later, they hired their first surgeon.
That surgeon was J. McFadden Dick, who personally knew our next guest, the oldest living surgeon to ever practice at TidalHealth Peninsula Regional. And we would like to welcome Dr. Nevins Todd Jr. He is the author of a new book looking back at the 125 years of surgery at the hospital. Dr. Todd,
right.
Thank you so much.
It's my pleasure. I was concerned that the history would disappear if somebody didn't write about it.
Exactly. Well, thank you for doing that. So tell us, what was it like doing the research for this book?
Well, it was not difficult, except for, you know, a lot of these surgeons are dead, and you have to find out if they had survivors, and if so, where they live, and get in touch with them. So that takes a little time, you know. If you find out where somebody is living, and then you got to write them or call them. Then, but before you have any material to use, it'll be a month. So it takes a few months to, you know, get it together.
Sure, sure.
So,
but everybody's very, very compatible, and everybody was very helpful. So it went all right.
do you think it was challenging for the early surgeons at...
Oh yeah, the main challenge at that time was there was not good anesthesia. And therefore, it was always a criteria of the surgeon to be fast. Have to be fast because you run out of pain medicine.
Oh my goodness!
But when they got, I think it was in 38, something like that, we got the full-time anesthesiologist, Dr. Tomasi came, and that made everything better. The surgeons started getting slower.
So how did you decide to become a surgeon?
Well, you know, I have a history of medicine in the family. My grandfather started the hospital. So I always heard about him. I did not know him. He died in 32, earlier than I was born in September, the same year. But my father, fortunately, was very close to his father and kept pretty good notes. So and I had the notes, and I didn't do anything with them for years until Steve Leonard, you know, the current CEO, told me we were going to have a 125-year celebration. Well, I figured the notes that my father had made, I should put to use. I should publish them, and that's what I did.
So this isn't your first book?
No, sir.
So let's talk a little bit about what it's been like seeing the advancements in technology and medicine.
Well, it's sort of a living story, you know. It's just like you walk in this studio and you see what they got today, you say, hey, I wasn't here 20 years ago.
Right, right. Oh my goodness.
A lot of things are different today. They're doing a lot of non-invasive surgery, and that's very good for the patient.
So what do you miss the most about surgery?
People I work with.
Really?
Yeah.
Why?
Well, you get to know your people like they're become not only your good friends, almost somebody you live with.
Is that right? Family?
Yeah. Yeah, it's an interesting situation. And the PGH has become a huge operation. I mean, due to the current CEO, you know, Dr. Leonard, he's done a magnificent job. And I was sitting there thinking yesterday, you know, I was in the emergency room, this is like a great big symphony. Everybody's playing their part and they come together. And it's beautiful.
Wow.
I don't think our population appreciates how well this hospital is run and how it compares to those throughout the nation of its size, you know. And of course, they get a lot of awards for that, but we are very fortunate in the years that they've developed the hospital. We have a magnificent hospital.
Dr. Todd, back to the book. Can you give us just an idea of what we'll find in the book when we read it?
Well, you got basically a description of all the surgeons. I felt that I knew most of them. I didn't know them. I know them, you know, a little bit better than I know you, some of them. But the public need to know that all these gentlemen who did their part in developing the surgery and also the hospital, it's almost impossible to separate the history of the hospital and the history of surgery. They go parallel. And the hospital has grown by leaps and bounds. I mean, if my grandfather were here living today, he wouldn't recognize it because he had a small hospital, and now it's a multi-building.
It's huge.
It is, Hodge.
How can we get your book?
How can you get it?
Yeah.
Well, there's copies available multiple places. The junior board, I think, is at the hospital is the main source right now.
Okay.
But whoever does all the arranging there, we're going to have a program down at Green Hill on the 18th of July that I think the public is invited. We have plenty of copies of the books. It's just a question of getting them to people that want them.
Yeah, gotcha.
Well, the name of the book is Scrubbing In 125 Years of Surgery at TidalHealth Peninsula Regional, and the author is Dr. Nevins Todd. Thank you so much
Oh, you're welcome.
for being here.